All right, so we are getting into our systems of healthcare unit or healthcare systems. I'm just going to let you know in advance, this is probably one of our drier units. I am going to run through this relatively quickly. I will try to point out the stuff that is important for your test. Since this is a shorter unit, we only have 3 PowerPoints. The test is not super long. So I know there's a lot of information in here, but go through your study guide and make sure that you're pulling out what it is that you need to know. Your book's a little outdated. It only talks for expectations up to 2020, which we've already passed. But just keep in mind, healthcare is one of our largest and fastest growing industries. We've talked about some of the different reasons, like home health care and geriatric care, and trying to save our costs in healthcare. So it was anticipated that by 2020, we would have over 22 million workers working in healthcare. One thing I want you to understand the difference between is our types of hospitals and then how hospitals are classified. So our types of hospitals are determined based on the services they provide. So we have 3 different ones. We have general hospitals that treat pretty much everything. We have specialty hospitals. So these can overlap. You can have, for instance, MUSC in downtown Charleston is a general hospital, but also offers specialty services. They have a psychiatric unit, they have pediatric care, they have a heart hospital. So they have a lot of different specialty services that are offered at their hospital. And then government hospitals obviously are going to be the ones that are operated or funded by our government, whether it's federal, state, or local. We do see these worldwide for our government service personnel that are deployed. And the closest one that we have here to us is going to be the VA hospital in downtown Charleston. Now, on the other side, remember, type is based on the services, as we have our classifications. And hospitals are classified based on the funding they receive or how they pay for the hospital to operate. So we have private or proprietary, which is where hospitals are operated for a profit. They want to make money. They get their money from patient fees and organizations that provide financial support. Religious hospitals like Bon Secours St. Francis in West Ashley and all of the associated Roper hospitals are a religious hospital that gets their money from religious support, usually from the church, and then their patient fees. Nonprofit or voluntary hospitals get their money from patient fees and then donations. And government hospitals, again, are from the money that they take out of our taxes and patient fees. So you'll see here that all of these have in common that they get money from patient fees. They all charge the patient for their services. Long-term care facilities are usually what we see or think of when we think about care for our elderly. It can also be care for physical or mental disabilities or people with long-term illness. When we look at a long-term care facility, which we're going to talk about a couple different types, the people that live there are called residents. So they're not necessarily called our patients or clients, but the residents of the facility. A residential care facility is something like a nursing home. They're going to help provide all of that basic physical and emotional care. And this is for someone who cannot care for themselves. So their staff is going to help with what we know as ADLs or activities of daily living. They're going to help provide a safe and secure environment. So if it's a memory care ward or somewhere with someone with Alzheimer's or dementia, it should have locked doors at all entry points so the patients cannot get out, because that is a safety concern. And then we've talked about this before, but it gives an opportunity for social interaction. As we get older, a lot of our friends and family start to either move away or die. So it gives the opportunity for people to still have that social interaction with individuals that are around their same age group or have some similar interests. Extended care facilities, otherwise known as skilled nursing facilities. Here's where we see obviously skilled nursing care, but primarily rehabilitative care. So this is going to be for people that have a goal of going home. So previously, when we talked about nursing homes, those folks are not going home. They cannot care for themselves. There is not going to be a change in condition that they can care for themselves. Whereas extended care is for people like after surgeries or after strokes to offer rehab so that they can get back to their home environment. And then we have independent living. You may see this called assisted living. This is where people are purchasing or renting a unit in a larger complex. These people tend or should be able to do all of those ADLs by themselves, but the facility or location will offer services like assistance with meals, housekeeping, laundry. For instance, if someone can live their day-to-day life by themselves, but they can't drive, this would be a great place for them, and they can get assistance with that transportation to and from doctor's appointments or other events. A lot of times we do see independent living facilities that are associated with or attached to nursing homes or extended care facilities. Because if something happens to this resident, for instance, they have surgery or they have a stroke or a heart attack, they have the opportunity to go to that extended care facility and get the rehab and come back, or they can transition to the nursing home if whatever injury they've suffered has caused enough damage that they're not going to be able to go back to living on their own. Just some additional services that we might see long-term care facilities provide: delivery of meals to people's homes, those senior centers or adult daycares we've talked about, and social activities. If you go into any assisted living or nursing home in the area, you will almost always see that there's a calendar of events, at least in one or two places, that show all the different things that they're doing throughout the month. They usually offer things like bingo, crafts, games, dancing, just opportunities to keep their residents engaged and interacting with each other. Again, I'm going to run through these kind of quickly just because hopefully they're all things we're familiar with. Medical offices, just like a lot of the things that I'm going to talk about, they can range from either being privately owned by one or two doctors to being part of a large complex that runs underneath a hospital group. They tend to offer services like diagnosis, treatment, exams. A lot of places have lab testing in their facility. They could offer minor surgery. So, for instance, if you go to the doctor for an ingrown toenail, they'll numb it up, cut it out, wrap your foot up, on your way you go. And depending on the type of office, they're either going to treat a variety or range of illnesses or ages. So, for instance, a general practitioner or family doctor might see everyone from babies up until our elderly population, whereas there are other specialties that we have here in the United States, like pediatricians or gerontologists, that treat specific age groups, or oncologists or orthopedics that treat specific conditions. Concierge medicine, this is pretty much when you pay to have a doctor on call for you almost all the time. The doctor is going to have less services or less patients because they have to be available to provide those services. But one thing they may do is come to your house to do house calls or be on call 24/7 or come to do a same day appointment, where if you're just going to a regular doctor's office, you're not typically going to have that availability from your doctor. Dental offices, again, going to just range from either private offices or a group of dentists. I've never seen them in a major retail store, but your book says that they exist. And we may see general or specialized dental care, like a orthodontist is going to have more specialized care offered than just a regular dentist. Clinics, we see in a variety of different areas. Just like everything else, it can be a group or an individual or part of a larger corporation. Some of the different types of clinics we might see are surgical centers, where you go in, you have your surgery, and you go home that same day. Urgent care, we have a doctor's care in Monk's Corner, and we have a couple other places nearby in Somerville or Goose Creek where you can go to get first aid or emergency care if you're ill or injured. This does treat pretty much all minor things, so you can go be assessed for broken arms, ear infections, fevers, whereas the more major medical problems like shortness of breath or chest pain or signs of a stroke should make sure to go to an emergency room. Rehab clinics are where we're going to see physical, occupational, or speech therapy. So again, someone who's had a stroke but doesn't necessarily need that long-term care facility is still going to go for some sort of rehab. Or my husband, he just had a hip replacement. He's still going for physical therapy so he can learn how to use those muscles again and build up strength back up in that leg. Substance abuse clinics is where we see rehabilitation for drug and alcohol abuse. Specialty clinics are going to be based on their specific disease, so whether it's a diabetes clinic or a kidney clinic. And then our outpatient clinic, very similar to a surgical center, but they may not be doing surgery. So they're doing care, whether it's x-rays or labs, for people without being admitted to the hospital, but they're usually part of a hospital or larger group. When we look at health department clinics, so our health department at South Carolina DHEC has clinics all over the area. They can offer a variety of services such as pediatric assessments, testing for sexually transmitted infections, taking care of and managing respiratory disease, vaccinations, and then depending on the area and the clinic, they'll have other specialty services. One thing it is important to remember is that these clinics do not all offer the same services. One might be specific to pediatrics and vaccines. One might be specific to women's health and STI testing. So before you go, you want to make sure you check on their on their website or give them a call to confirm what services they offer. University medical centers, pretty much MUSC is the one closest to us. They offer the same care and treatment, but it also allows for a learning experience for medical students. So be aware that if you go, there's a good likelihood you will be treated by a resident or medical student as long as you give permission for that. Optical centers, where we get our eyeballs checked out, again, can be individually owned or part of a larger chain, so something like Pearl Vision. They're going to do your eye exams, prescribe and potentially sell your glasses or contact lenses, and watch for the presence of eye disease. When we get to the down and dirty of treatment, the ophthalmologist is going to be the one that treats the eye disease. Emergency care services, so again, special care for our accidents or illnesses. Ambulances are probably the one thing that people think of most. These can be private or government owned or operated. So government owned and operated would be things like our county ambulance services, so like Berkeley County Emergency Management Services. Whereas private ambulances are things like Roper Lifelink or MedTrust. And what they tend to do is usually transports, so between facilities, or if someone at a nursing home has a doctor's appointment, they'll take them there and then bring them back. Rescue squads tend to be volunteer organizations. Our emergency clinics and centers, we have a couple around here. We have Trident Moncks Corner. We have Roper Berkeley. And then over in Nexton in Somerville is Brighton Park, which are all freestanding emergency rooms. The biggest difference between those and the emergency room at the hospital is that at the freestanding emergency room, if you have to be admitted or stay overnight, they'll have to send you to the hospital they're associated with because they don't have the capability to keep you overnight. The emergency rooms in the hospitals, again, have the ability to admit you for overnight observation, and some of them, depending on the clinic, may have more testing capabilities. Like you're not going to see a lot of MRIs in the freestanding emergency room clinics, or sometimes as many options for services like ultrasounds. Then our helicopter and airplane emergency services. One thing to keep in mind is that these are extremely expensive. So if you work in an area like EMS or the fire department where it potentially is your decision to use a helicopter, we've talked about making sure that we don't sacrifice the quality of care to save money. So you have to be able to determine, does this patient absolutely need this costly service, or can I deliver them a same level of service if it just takes us a little bit longer to get to the hospital? Labs, we've talked a little bit about, but they can be, again, part of a facility like in the hospital or their own center like LabCorp. Medical labs will do our diagnostic tests. And then our dental labs, if you ever have to get dentures or a retainer and they make the mold of your mouth, then it goes to the dental lab where they make the actual retainer and send it back for you to use it. Home health care, like we talked about in our last unit, we're providing that care in the patient's home. It can be anything from nursing to assistance with personal care like bathing or dressing. It can be therapy that's done in the patient's home, or some of those homemaking services like food prep or cleaning. Hospice agencies help care for terminally ill patients or people that have a life expectancy of less than 6 months. So death, for whatever reason, is relatively imminent. Here, our care tends to be provided in the patient's home or potentially at a hospice facility. It really just depends on the location. Some places don't have hospice facilities nearby, or all of their beds are taken up. But ideally in the patient's home, if that's okay with the patient and the family. One thing you do need to know is palliative care, which otherwise is known as comfort care. It helps provide support for the patient, keeping them comfortable, and this is the type of care that we see provided by hospice agencies and nurses. As a result, our patient is allowed to die with dignity. We tend to see that the doctor takes them off a lot of their unnecessary medication, and they may just be taking pain medication or the only medications that are absolutely necessary. Throughout the process, the nurse and the hospital or the hospice social worker will help provide certain counseling for the patient and their family. And then after the patient passes away or dies, they'll help provide follow-up support for the family. So it's not just like the patient dies and they're done with you. They help some of that follow-up support for the family, because even though they've prepared for this to happen, no one's ever really ready for the death of a family member. Genetic counselors can be either independent or inside of another facility. A lot of times you'll see them in clinics or doctor's offices, and they work with couples or individuals who are pregnant or who are wanting to get pregnant. One of the main things they do is perform prenatal screenings to check for any genetic abnormalities or birth defects. And then once those results come back, they help explain the test results and then explore some of our medical options if there is a birth defect present. So we're not going to get into an abortion debate, but it's important to take into consideration some of these birth defects or genetic abnormalities can result in babies that either won't survive the duration of the pregnancy or will die shortly after they're born, or may have a condition that's just going to be extremely difficult and emotionally trying for the parents and expensive to care for the child. So they'll help present different medical options to see what's best for that family with moving forward once a birth defect has been identified. They also help cope with potential psychological issues caused by a genetic disorder. For instance, there are disorders that the baby has an extra sex chromosome. And as you can imagine, that's going to be something that's going to be a little bit difficult for the child to deal with as well. So helping provide resources for how to deal with any disorder that's going to potentially affect how the child reacts. Their primary target demographic is going to be when the woman is in her later childbearing years, or what they call advanced maternal age, which is over 35, or if there's a family history of genetic disorders, or if the patient's of a race or nationality that has a higher incidence of a specific genetic disease. I would make sure that you know two of the diseases genetic counselors work with are Down syndrome and cystic fibrosis. Rehab facilities, just like we talked about a little earlier, they're going to help provide care for patients with any sort of physical or mental disability and help them get to a level of where they're providing their maximum self-care. So whether that's speech or occupational or hearing rehab, for instance, if someone has a stroke and they want to try to get back to a place where they're walking on their own or feeding themselves, a rehab facility would help get them to a place where they're doing the best of their ability and ability to function. Occupational health clinics. So these can also be known as our industrial healthcare centers. They help provide healthcare for people that work at this specific place. So I know Volvo has one. I believe the Mercedes place has one. And they're providing services only for the employees of Volvo or Mercedes. Now, sometimes that's like a basic exam or a ready to work exam. A lot of what they do is on the job injuries or safety, and then when needed, any potential medical or emergency care. Some places like Disney, they might have the option to provide emergency healthcare to their visitors. But for the most part, when we talk about these industrial healthcare centers, we're talking about providing healthcare for the employees. School health services, I know that a lot of people are going to say, but our nurse just gives us ice. I understand this is a general point of view, and a lot of this may be more pertinent to what we see in college healthcare services, but they're going to provide emergency care for students. Now, whether that is just giving ice for swelling or putting a splint on or calling 911, they should help with tests for specific health conditions like speech, hearing, or vision. With the presence of more of our speech language pathologists in schools, we're seeing some of those testing or diagnostic criteria being shifted responsibilities to other people that are more suited for that specific area. Ideally, we'll have promotion of health education, helping to keep a safe, sanitary, clean school environment, and then counseling as needed. Then the last thing we're going to talk about are pharmaceutical services. So we've all known some of these large drugstores or chains like Walgreens or CVS. We have Delta Pharmacy, which is a little bit of a local chain here in Moncks Corner. They help link our health science with our chemical science. They make and dispense medication, provide patient education. So for instance, if a female is taking birth control and gets prescribed an antibiotic, often that antibiotic will make the birth control less effective. And so it's the pharmacist's job to educate the patient on that specific interaction between those medications. They all have over-the-counter drugs where you don't need a prescription, so things like Tylenol, Benadryl. But there are some over-the-counter medications like Sudafed that you still have to be 18 to purchase and show an ID for. Some of the places we'll see these are hospitals, clinics, nursing homes. There are even online pharmacies where you can send in your prescription and they'll just mail it to you. But otherwise, that's our down and dirty for healthcare facilities. The other two lessons we're going to talk about are government agencies and then insurance. So I know none of this is super exciting, but if you have any questions, let me know. Otherwise, I will see you next time.